Tantor Audio, a division of Recorded Books, presents When Your Teen Has an Eating Disorder, Practical Strategies to Help Your Teen Recover from Anorexia, Bulimia, and Binge Eating, by Lauren Muhlheim, PsyD. Foreword by Laura Collins Leister-Mensch. Narrated by Emily Ellet. Publisher's Note. This publication is designed to provide accurate and authoritative information in regard to the subject matter covered. It is sold with the understanding that the publisher is not engaged in rendering psychological, financial, legal, or other professional services. If expert assistance or counseling is needed, the services of a competent professional should be sought. Forward. As a parent whose precious child was almost killed by an eating disorder, I know the emotional impact an eating disorder can have on the entire family. Today, our daughter is alive and thriving. I'm an advocate now, and I've spent years talking to policymakers, clinicians, researchers, and families affected by mental health crises. When I speak with a parent, we don't discuss the science or statistics or theory. We talk about that one precious son or daughter, about that very day and that next meal, and keeping the whole family afloat when time, money, and hope are in short supply. This book is about that moment in your life, and about your family and your suffering loved one. All the theory and policy and data are useless and of little interest when you are living with constant struggle and being haunted by genuine fears for the life of a young person in your care. If you are a parent picking up this book, you are likely facing a daily struggle and in need of direction and practical ideas from a trustworthy source. You are looking for problem solving and for clues that this will be a useful investment of your time and trust. You are looking for a resource that helps you in the real world, where families may not have cutting-edge clinical support and a knowledgeable community. You need help today, not next week or next month. I've been there. I have 2 shelves of eating disorder books for parents written during the past 30 years. I have even met and talked with most of the authors. And although all my dog-eared copies contain numerous pearls of wisdom, none of them contains all the pearls in one publication. What has been missing is a book that puts the practical and the best available science in one place. This is that book. When Your Teen Has an Eating Disorder is about your teen, in this year, in your care. Your quest to understand the illness and to be the most effective parent while you support your child to recovery is some of the best parenting you will ever need to do. It's hard, but no one promised you that parenting would be easy. It's also confusing, but not too much for you to handle. Just as you found your way through teething in toddlerhood with your unique little person, you will find your family's unique way through this. Your solutions will not be exactly like anyone else's. That is why Lauren Muhlheim's approach works. Instead of being given prescriptions and directives, you will be empowered to choose solutions that work for you and your family. Instead of blaming you or your child for the problem, she sees you as the most important element of the recovery journey. It is a journey. As a parent who has been there and known countless families around the world who have faced an eating disorder, I wish I could give you a map with a straight line to success, but your path will reflect your family's strengths, history, and values. I wish I could assure you of success, but that is for you to both define and to own. Families struggle, stumble, and get back up again. Not all are successful, but that is why the tools you choose and the loving commitment and energy you put into the journey matter. There will be voices in your ear. You may have heard them already, promising easy and definitive answers. You will hear attractive solutions that align with your beliefs and your fears. You may be tempted to choose the most expensive option, thinking it is likely to be the most effective, or the closest to home because you want to keep life normal, or the one that promises the fastest results because you think you can't bear any more resistance, disruption, or uncertainty. You may even be considering an option that takes you out of the picture for a while and the problem out of the house. But if you look at the data and you talk with researchers and successful families, it is clear that the best place to recover is at home, the best daily providers are family, and the best professional supports utilize modern methods backed by research. This book is the tool I will be giving parents, because Muhlheim's approach as a therapist, writer, and leader in our field is empowering to all of us. You will find her to be a clear and respected collaborator as you work with your own treatment providers, family members, and support team. She is practical, she is evidence-based, and she believes in the power and loving commitment of parents. Parents are my best teachers, Muhlheim says. Families benefit from an approach that is informed by and celebrates the wisdom of families. Not all of us are fortunate enough to have a clinical team that is up to date on best practices and thinks parents are central to treatment, but you deserve that and can find it in this book. You can share the strategies in this book with your providers, and you can demonstrate your courage and commitment to being a major part of the solution. Muhlheim brings you onto the treatment team and regards you as a collaborative team player. She shares her clinical insights and the stories of families she has known. She addresses you directly, with respect for both your commitment and your skills. She believes in you, as do I. You are not alone. The tools and tips and perspectives in this book will be steady companions as you do some of the most important parenting of your life. Laura Collins Leister-Mensch, author and advocate, Warrenton, Virginia, February 2018. Introduction. If you've picked up this book, your teen has likely been diagnosed with an eating disorder. If your teen has not been diagnosed, but you are concerned enough to be reading this, something is probably going on. You may recognize the need for your teen to gain weight, but can't figure out how to get her to eat. Maybe your teen is engaging in unhealthy behaviors, such as severe dieting, binging, purging, and excessive exercise that you don't know how to address. Or perhaps your teen is in an eating disorder treatment program that excludes you from the treatment altogether, and you want to be more involved. You are probably feeling scared, confused, and overwhelmed. The good news is that you can confront the eating disorder as a family. Not only does this better empower you, the parent, it is actually the most effective way to tackle an eating disorder. My 10 years as a therapist for families facing eating disorders have convinced me that treatments in which parents play a central role offer the greatest, maybe the only, chance for your teen's full recovery. There are many ways to support your child. In this book, I will teach you how to put your love into action and feed your child back to health. A few words on this book's terminology. When I refer to parent, I mean it to include caregivers and legal guardians. When I refer to your teenage child, I use the words teen and child interchangeably. Family-based treatment. It can be difficult to know who to turn to for help. Many communities lack knowledgeable, skilled providers. You may be told that your child's refusal to eat is just a phase and to return only if she gets worse. You may be encouraged to send your teen away for more intensive treatment. You may be given conflicting advice and don't know what to do. However, it's been my experience that waiting for your teen to worsen or being intentionally left out of the treatment plan is ill-advised. What does work is putting parents in a highly supportive role as soon as possible. Research demonstrates that parents can powerfully support their teen during the years it can take to recover from an eating disorder. This model of care diverges from the traditional, individually focused therapeutic approach. A family-centered approach immediately targets malnutrition and problematic behaviors, and it offers parents the opportunity to help their teen recover faster and more completely. This book is based on the leading treatment from this school of thought, family-based treatment, FBT. This approach empowers parents to oversee renourishment and remain embedded throughout the entire treatment process. FBT has become the leading treatment for child and teen eating disorders, including anorexia nervosa, bulimia nervosa, and atypical and subthreshold eating disorders. because it places you at the helm of recovery, driving your teen toward healthy eating and other recovery-consistent behaviors. FBT represents an about-face from traditional treatments that blame and exclude parents. Act now. In my practice, parents sometimes want to take a wait-and-see approach, or they worry that prematurely taking charge will make things worse. I've even heard pediatricians advise parents, FBT is too extreme at this point. Why don't you wait a few months? But in my 8 years practicing FBT, I have seen no case in which parents aggravated a potential eating disorder by drawing attention to it. I have never met a parent who regretted intervening, only parents who regretted their hesitation. Even if your teen's eating disorder seems mild, or you aren't sure he has one, I encourage you to make resolving the problem a priority. Not doing so can risk your child's future. Some teens die from eating disorders, and others remain ill for decades. The window of opportunity is finite, and undertreatment at the onset worsens the prognosis for a disorder that can become chronic or fatal. Early intervention drives superior outcomes. Dieting and other eating disorder behaviors are reinforced through repetition and become more ingrained over time. Allowing these behaviors to run their course without interruption makes them harder to break. The longer someone with an eating disorder engages in behaviors, the greater the risk for permanent damage. So don't delay. Seek help for your child right away. Stay committed. Plan to stay committed for as long as it takes. Eating disorder recovery respects no set timeline. Full recovery requires time. Eating enough food regularly throughout the day, maintaining a healthy weight, and refraining from restricting, binging, purging, and excessive exercise for an extended span. In most cases, for years. Whichever type of treatment your teen receives, there is always room for parents to provide meal support and encourage recovery behaviors. The work I prescribe for you will be hard and require focus. It will demand a big time and energy commitment. You will be doing work that at a treatment center would be performed by trained professionals. Prioritizing the eating disorder may mean putting you and your child's lives on hold. Some parents may need to take time off work or postpone vacation plans. Extended family members may need to play a supportive role. Some young adults may need to delay going to college. Putting recovery above all else can be a struggle. You may have trips or other family objectives planned. You may fear that canceling an activity will disappoint your sick teen or her sibling. But consider this. If your child had diabetes or cancer, how would you prioritize her treatment versus other family activities? An eating disorder can be just as deadly as these better understood disorders. You hold your teen's fate in your hands. You must persist in making recovery a priority. Don't wait for your teen to want help. Accept that your child may reject your involvement in treatment, your management of his eating, or even receiving any treatment at all. This is common. Many parents who want to allow their child a role in his own recovery may be tempted to delay treatment until he is willing. But without intervention, that willingness may never develop. I believe that the research on the efficacy of FBT suggests that waiting for teens to want help is a mistake. You, the parent, can be a change agent. You must act on your child's behalf and seek treatment for him, especially if he is under 18. At this age, most teens are neither emotionally nor cognitively able to make good decisions regarding recovery. Your teen still lives under your roof. Capitalize on this opportunity to act now. An eating disorder can tighten its grip once a young adult moves out. Many adults with eating disorders had teenage onsets that were inadequately treated. Take your teenager to a professional to receive a formal diagnosis and rule out other medical explanations. If practical in your area, ensure that the professional is an eating disorder expert, or, at a minimum, takes your concern seriously. However, if the professional reassures you that everything is okay, but you still feel that something is amiss, don't settle. Even medical professionals commonly miss the early signs of an eating disorder. Why I wrote this book. I am a clinical psychologist, an eating disorder specialist, and the mother of teens and young adults. During graduate school, I trained in a bulimia research lab. This work profoundly influenced me, and I have remained close to the research world ever since. We clinicians deliver the best treatment for specific conditions when we consult the research. While working in China in 2010, I encountered teens whose treatment at inpatient clinics meant sending them to the United States or Australia, a whole continent away from their parents. Desperate for a solution that honored the family bond, I began my training in family-based treatment, FBT. The FBT therapist's role is to empower parents to manage their child's recovery. The therapist's stance is encouraging but not prescriptive, not telling parents exactly how to accomplish the mission, but coaching them to problem solve. There is a shortage of appropriately trained professionals to guide the number of families needing help with this approach. Until recently, little written material about this process has existed. Several online parent forums and organizations have formed to provide assistance, but there remains a lack of formal parent resources. As a mother, I can relate to parents' terror in dealing with these devastating illnesses. Empowering families to help their children recover, rather than sending them away to be fixed by someone else, is my work's greatest reward. I have worked extensively with parents of teens with eating disorders and know their concerns about helping their children. I have also worked with entire treatment teams, including medical professionals and registered dietitians. My work today is dedicated to empowering parents. My passion is providing parents the tools and evidence-based principles to help their teens heal. Who this book is for. The program outlined in this book, based on FBT, will provide the tools to help your child and family reclaim your lives. As loving parents, you are uniquely qualified for this job. Specifically, this book is aimed at you if one of the following is true. You have no reliable access to treatment and are looking to help your teen recover without the help of specialists. Many parents attempt to help their teen recover on his own without appropriate therapeutic guidance. This book attempts to bridge the gap for families living in areas with limited treatment options. Your teen is in a non-FBT treatment. I believe you can still provide meal support and structure to support your teen's recovery, but please discuss this with your treatment team. Your teen is already in FBT, and you want to supplement it with additional knowledge and guidance. Parents might be able to begin the process of restoring a teen's nutrition and eating patterns to optimal levels without a therapist's involvement, but more intense or challenging symptoms may require expert care. At a minimum, your teen should be examined and seen regularly by a medical doctor to monitor for serious medical complications, a discussion of which is beyond this book's scope. This book's strategies may help parents of teens with any of the following: anorexia nervosa, bulimia nervosa, other specified feeding or eating disorder, OSFED, subclinical disordered eating, and in some cases, avoidant restrictive food intake disorder, ARFID. The binge cessation strategies can also be applied to binge eating disorder. If an eating disorder is wearing you down, or you have been instructed to step back by well-meaning but poorly informed professionals, this book is designed to reinstate you to your fundamental job of parenting, because your child needs you now more than ever. This book makes uncommon offers, the permission to take an active approach, and the tools with which to do so. What this book will cover. I survey the different eating disorders and the mechanisms that maintain them. I discuss the benefits of a parent-supported approach and recount cases of parents who helped their teen recover. I address target weight establishment based on childhood growth patterns, meal plan implementation, increasing the caloric density of meals, planning, supervising, and delivering meals, and supporting children to consume the food you provide. I suggest incentives to get your teen to eat, as well as how to limit other behaviors, such as exercise, binging, and vomiting. I also include suggestions for maintaining calm during meal times in the presence of an escalating teen. I cover coping skills for parents and teens, food flexibility expansion and eating behavior generalization to other settings, returning control to and helping your child with the development of independent and intuitive eating, how to deal with special situations like travel and college, and relapse prevention. The strategies I provide in this book are derived primarily from FBT for eating disorders, with input from cognitive behavioral therapy, CBT, the leading eating disorder treatment for adults, and my clinical experience. This book offers parents practical suggestions and an array of options for returning your teen to optimal health. There are many ways to support your teen. No single method works for all families. The only course parents should avoid is to do nothing. Expect this to be difficult. Specifically, you will be asked to plan and prepare meals and eat with your teen for as long as it takes for your teen to be able to eat independently without eating disorder behaviors. The process you will undertake is akin to running a residential treatment center in your house. It can involve supervising your teen between meals and, in some cases, around the clock. FBT includes the gradual return of control to the teen in a way that supports her long-term recovery. Along the way, you may need to examine your own beliefs about healthy eating and weight. This is what success can look like. Your teen has ceased to exercise excessively, is eating healthy amounts for his growth, and has re-engaged in moderate sports participation. Your teen is no longer a regular emergency room visitor with an unstable heart rate. He maintains a healthy weight with minimal meal supervision. Your young adult is in college 3,000 miles away, eating regularly and independently while in remission from the eating disorder. I believe in parental intuition. My intention is to arm you with knowledge to inform this instinct and empower you to act. Feed, love, heal. Feeding and helping your teen recover are acts of love. However, love is not always easy or gentle. The strength and resolve you show will bring your teen back to health. There will be stress and challenges, and I will offer suggestions for managing those. This is not going to be easy, but it will be one of the most rewarding things you will ever do as a parent. Online materials. At this book's website, http://www.newharbinger.com/40439, I provide free supplemental materials, including forms and worksheets, to help you think through the application of the strategies I share in this manuscript. Discussions of specialized topics and additional resources may also be found there. Chapter 1. What's happening to my teen? In this chapter, I'll walk you through some background information that will help you better understand eating disorders and how they may affect your child. You'll be given tools to assess whether you are facing a problem and learn concepts that will help you to help your teen recover. The 9 truths about eating disorders. Some myths about eating disorders are so widespread that the eating disorders advocacy community has created a consensus document, 9 Truths About Eating Disorders. Please refer to http://www.newharbinger.com/40439 for information about the truths. Meet some teenagers with eating disorders whose families supported them in their recovery. Valentina, 12, had been considered slightly overweight prior to a growth spurt. Her weight remained stable, but she grew several inches. Over time, she became obsessed with her weight, reading food labels, eating minuscule meals, and avoiding starches. Valentina began exercising and criticized her old eating habits and those of her classmates. She began to avoid rice, a family staple. In 2 months, her weight plummeted. Alarmed by her weight loss, her parents encouraged her to eat more, explaining it was for her health. Valentina told them she got full quickly and refused to eat more. Oscar, 15, became more restrictive in his eating and obsessed with building muscle. He said he wanted six-pack abs. He started doing sit-ups and push-ups, running and throwing up after meals. He wore extra layers of clothing to encourage sweating, which he hoped would increase weight loss. Oscar frequently checked his physique in the mirror. He lost weight while growing. He was especially frightened of fried foods, believing any fat he ingested would show on his body. Susan, 16, swam on her high school and club teams. One teammate often threw up due to the intensity of the practices. Susan feared that she too would start to throw up and began refusing to eat dinner prior to practice. When Susan returned home after practice, she wasn't hungry. Over the course of a few months, she lost several pounds. Her period stopped. As her fear of vomiting increased, her eating became increasingly restrictive. Karen, 17, taught yoga and insisted on vegetarianism and clean eating. She appeared to be living a healthy lifestyle, but parents discovered from her worried friends that she was binging and purging. Do any of these stories feel familiar? They illustrate just some of the many ways that eating disorders may present in a teen. You may not even be sure your child has an eating disorder, but maybe you have observed strange behavior at meals. Maybe your teen has become extremely picky about what she is eating. Maybe your teen is obsessed with food labels or watching the Food Channel. Maybe your child has lost a lot of weight but is not skinny. Maybe you have a son and wonder whether it's even possible for a boy to have an eating disorder. How do you know how seriously to take this? Types of eating disorders. There are several types of eating disorders. What follows are descriptions of the major diagnoses based on the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition. Most real-world eating disorders do not fall neatly into a single category. A patient often exhibits signs of more than one disorder, either at different times or concurrently. Yet these disorders share broad similarities in the dangers they pose to the individuals and the treatments that are effective. Be aware that eating disorder symptoms may fluctuate over time. The specific eating disorder identified may even change, a phenomenon that researchers call diagnostic crossover. For example, 1/3 of patients with anorexia nervosa will eventually develop bulimia nervosa. Tragically, misinformation about eating disorders abounds even among medical professionals, who usually receive little training in eating disorders. Missed opportunities for diagnosis are common during the early course of a young person's eating disorder. If a clinical diagnosis is negative and your gut says otherwise, follow your gut. The sooner your teen gets help, the better. Binge eating disorder. Binge eating disorder, BED, is the most recently recognized eating disorder and the one most common among adults and males. Individuals with BED engage in episodes of eating large amounts of food in a short period of time, usually accompanied by feeling out of control. For example, they may eat a box of cookies or several containers of ice cream in one sitting. Individuals with BED usually think constantly about dieting while feeling a compulsion to binge eat. This compulsion is coupled with anxiety, shame, disgust, guilt, and self-criticism around eating. While BED is found in higher rates among people of larger body size, it can be found in people with bodies of any size. Individuals with binge eating disorder may start each day as if they are on a diet, but they break all their diet rules by the end of the day. Bulimia nervosa. Bulimia nervosa involves obsessive and irrational thoughts about the body, food, and exercise. People with bulimia nervosa will repeatedly start a diet, but then blow it and surrender to compulsions to binge eat. Binges often result from the pressure created by setting rigid rules against eating certain forbidden foods, such as desserts. These foods become irresistible. The individual violates the rule and binges. The distress over having overeaten is followed by behaviors designed to compensate: vomiting, fasting, excessive exercise, and laxative and diuretic use. Those with bulimia nervosa may show only one or multiple types of these behaviors. Anorexia nervosa.
Sample complete. Ready to continue?